is hyperbaric medicine, and how, as a physician, is that important in medicine?
Hyperbaric medicine is not an area that a lot of physicians or patients know a lot about, so that is the key question. Hyperbaric medicine essentially encompasses giving 100% oxygen to a patient who has a particular health condition inside of a chamber, and that chamber may be for a single person to go in, or multiple people can go into larger chambers. And they go into the chamber with the 100% oxygen, and it's administered under pressure. In other words, this is a normal pressure in this room, so they are increased pressure inside of the chamber. So they may be 1.5 times the room pressure, or twice or higher than the room pressure. So it's equivalent to, or similar to, the experience of scuba diving. You're going down 30, 40, 60 feet underwater. So that's kind of the equivalent pressure sensation if you've ever experienced scuba diving. And so that's the type of equivalency that you would appreciate for that person when they're in a chamber. Generally they're fine. They don't really notice much problem in the chamber, but they may have some problems with their ears or their sinuses. The same as scuba divers might experience, or you might experience going up, changing pressure on altitude. Yeah. Otherwise, the majority of people are quite comfortable in the chamber, and they feel quite good.
Right. Now, can you explain to us, just on a high level, some of the benefits and the types of people, if they're listening or watching at home, who might benefit from oxygen therapy?
There's a lot of different types of patients who can benefit from oxygen therapy. In Ontario and probably the other provinces, there's probably 14 different categories of conditions that the provincial health plan will actually cover. And those include a lot of patients who have wounds that aren't healing, related to diabetes.
Right.
Because they have poor circulation, they have nerve damage because of the diabetes. Patients who've got poor other types of circulatory problems in their legs in particular, or they have wounds from other problems. They haven't healed from surgery, they've got bad injuries that aren't healing properly. So that's a big category of patients. Other groups of patients are those who have radiation injuries from chemotherapy. Many patients get chemotherapy for their cancer, and they get radiation as well, and so they suffer nerve damage from the chemotherapy. They may also suffer tissue damage from the actual radiation, and it might not happen for 12, 13 months or 2 years, longer, after the radiation is administered. So then they will come in with things like bleeding from their bladders, bleeding from their rectums, tissue pain in the area that was radiated, and those patients respond very nicely to hyperbaric treatments, right? So that's another big category. Outside of that, there's people who have sudden hearing loss.
Right.
OHIP will also cover those patients. Very often it's a virus or something that's happened to their hearing, and if we get them in time, the hyperbaric oxygen can actually help that recover some of their hearing, right? Outside of OHIP, there's a lot of other conditions that we also treat, things like concussions. Patients who have post-concussion syndrome, as we call it. They have bad headaches, they feel dizzy, they can't concentrate, they can't use their computers, they can't sleep properly, a whole set of symptoms that concussion patients suffer. So those patients actually do very well in the chamber, but OHIP's not paying for them yet.
Right.
We're working on that.
We're working on it. And that's why shows like this are so critical to educate.
So that just give you a touch.
Yeah.
It sounds like there's a lot of benefit. You're in marketing, Izaak. We've heard over the years of various celebrities that have invested in this technology, and it seems like it's been a really well-kept secret. You have, in fact, used this technology, this treatment, and you've benefited. And can you speak to what your treatment was like?
Yeah, so I've been doing hyperbarics for close to 10 years now. I've come in for anything from minor scrapes and bruises. I've gone in for a few concussions. I had shoulder surgery about 4 years ago, and I came in for that post-surgery to get my wounds healed. It sounds terrifying because it's a very large name, but really it's very simple. Your treatment is basically you're laying down in a chamber or standing up, and the chambers that under pressure uses is mono chambers, so we have TVs hooked up to all of them. Other ones are different, of course. You have the soft shell ones that most athletes use, and you have the group ones.
Soft shell?
Yeah, so they're portable plastic ones that use an air tank instead of ones that are hard place. A lot of sports players and athletes like LeBron James would use one like a soft shell. Hard shell ones are mainly for more serious conditions.
Less portable, I guess.
Yeah.
Yeah.
Well, the soft ones you can't see either out. They're dark.
Yeah,
sided,
they're zipped up all
so
the
there's
way
a
with them.
claustrophobia issue in some of
Absolutely.
those.
Okay.
Patients actually can't see out, whereas we have the chambers that you can see all around.
Yeah,
Oh,
the
that's-
monoplace chambers are
Yeah.
100% acrylic glass
Yeah.
on the outside.
Yeah, I had the privilege and pleasure of doing a bit of a tour prior to having you come on the show, and clearly, like you said, I mean, people are watching Netflix. They look very comfortable. They can see it's a beautiful environment and a welcoming environment, and I think that speaks, and it's really important when people are coming in pain, and they're frightened, and they've tried a lot of things, and they really don't know where to turn. All of those things matter. And one of the things I felt, Todd, when I walked into this place was these people care. And the treatment, right through, it really is very integrative and holistic, which I really like.
It's a very calming environment.
Yes.
We've tried to set it up so it's a very calming environment. And the chambers themselves are calming. Because
Yeah.
once you're in there, you're kind of in a little cocoon,
Yeah.
right? So it's generally intended to be relaxing and calming while you're getting the treatment itself.